In this clip, we're going to look further at the differential diagnosis of hypercalcemia, and we're going to look at how the parathyroid hormone related peptide causes hypercalcemia in some cancers. So let's look at hypercalcemia of malignancy. A 73-year-old male presented with drowsiness and confusion and 20-pound weight loss in 1 month. He was found to have a high serum calcium, a high ionized calcium, and a very low PTH. Further evaluation revealed that he had multiple myeloma. Multiple myeloma is a plasma cell cancer that causes something called a pepper pot appearance, where you have all these osteolytic lesions, that is, a plasma cells breaks down the bone and causes release of calcium. So in the hypercalcemia of malignancy, there is an increased release of calcium from the bone, and that happens in two ways. The bones can release calcium in malignancy because of something called the PTH-RP, PTH-related peptide, that is seen in some cancers, some solid cancers like squamous cell carcinoma of the lung, renal cell carcinoma, or breast cancer. Or there might be lytic bone lesions, that is the plasma cells in multiple myeloma themselves cause absorption and release of calcium. When there is increased calcium that's being released from the bone, this is sensed by the calcium sensing receptor. The parathyroid glands are normal, and when there's an increased calcium being sensed by the parathyroid gland, there is suppression of PTH release. And if there is suppression of PTH release, let's look at what happens to the kidneys. Remember that parathyroid hormone normally stimulates calcium uptake by the kidney. And so if there's less PTH, there's going to be more calcium being peed out. Also, remember, parathyroid hormone normally activates vitamin D. So if there's less parathyroid hormone, there's less activation of vitamin D, and then there's less calcitriol. What does calcitriol do? It stimulates calcium reabsorption by the intestine. So if there's less PTH, there's less 1,25-dihydroxyvitamin D3, and then there's less calcium reabsorption by the gut. So you can see that the body is really trying to get rid of calcium that's pouring in from the bones by increasing renal excretion and decreasing gut reabsorption of calcium. So in hypercalcemia of malignancy, you're going to see an increased serum calcium level. You're going to see a decreased serum parathyroid hormone level. Now, the decreased serum parathyroid hormone level in the setting of hypercalcemia is a very concerning and a very important finding, because then one should really start looking for cancer in that person. The serum phosphorus levels may be variable, and the treatment in this situation is a drug class called bisphosphonates, which basically are drugs that inhibit osteoclasts. Osteoclasts are the bone cells that bring about breakdown of bone to release calcium. That action is blocked by the bisphosphonates.